Good evening, all. So I work for Precedence Healthcare. I'm the National Sales Manager here, and tonight we're presenting our INCA platform. I'm going to go through the description of the platform and tell you kind of how it works and what benefits you guys are going to get out of it using it for both your 715s and your care planning. So first, I just want to acknowledge the traditional owners of the land, town and country through Australia and their connections to land, sea and community. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders of people today. So firstly, I want to give you guys kind of an introduction to what INCA is. INCA gives you a way of getting all this information that comes to you at the moment through all these different silos. So these silos include things like insurers, your My Health record, you guys, the primary care providers, the GPs, the allied health side of the vertical, the hospitals, the aged care facilities, and then the pharmacy. So all this information's out there, and how do we all connect it and make it available to be shared to provide the best care for the Aboriginal community? So what we came up with was the INCA platform. Now, what the INCA platform is a web-based secure platform, like Gil said, that takes all that information from the PMS, lets allied health add information to it and access it and help with the care coordination, lets aged care facilities or anyone in an aged care model, even at home, have access to it. Let the pharmacies also use their home medication reviews and all the drug information and drug advocacy, have access to it, and put it into a real easy to understand platform where then you can also get all your diagnoses, your test results, medication information. You get the care planning. We create the care plan digitally and share it within the platform, so you're not having to give the patient a piece of paper and tell them to go to their other providers or care team. This is all sent to them digitally. Each care team provider has access to the platform where they can see their referrals, their documents, and the patient information. It gives them the ability to also do patient monitoring. So outside of the practice, if the patient wears a Fitbit or a Google Fit and you tell them to do 10-kilometer walking, how do you know they've done it? Well, with the remote monitoring, it plugs in and then says, yeah, they did do the 10K. So you can hold them to it. The patient dashboard, so that gives you the list of all your patients that are on a care plan or a TCA arrangement, where it's at during the care plan or the TCA arrangement, if you're waiting for allied health to accept it, if the patient is logged in and looking at it. All that information shows in really easy to read dashboards for you guys to view and care for. Patient adherence. So the patient is more connected to it. They're following through on it. It's easy for them to understand. It's not a 27-page document that you print out and they sit there going, well, what's this? I lost page 3 because the dog ate it. The kids are in the backseat of the car tearing it apart and making it into confetti, all those kind of things. It also does the assessments, the 715s, which is part of this project. The difference between doing 715 and like your PMS and something like INCA, what it does is it's dynamic. So it dynamically changes and adds information from the PMS and the clinical information that you've got there with the patient. So you're not having to type as much. You can make better decisions about the way the assessment is going. And then the assessment then also links onto the care plan. So you've done a 715, it will go, okay, a care plan's available. You can do a care plan with this patient and it integrates into them. So it creates a perfect workflow for a project exactly like this. And that's why Gil, Jen, and the rest of the team at North Queensland PHN really loved it when they had a look at this platform and made it really easy for them and you guys to use. Mental health. So we do a lot of treatment plans around mental health as well. So non-MBS care plans, non-MBS item codes, also your K10, your DAS21s, and any other like mental assessments. We do them all built in. It makes it really easy for you guys to do assessments. And also when you do assessments, what it does is it only shows the assessments that are available to that patient. So you don't have a laundry list of all these assessments on your PMS and you've got to sit there going, well, is this patient able to do this assessment or are they in the right bracket to do this assessment? The system logically will show you which assessments are available and able to be done with this patient via their age group, demographic, and any other clinical information that it shows. So the benefits of it, what it does is, firstly, it builds a really good rapport with your patients. You're not spending that much time doing a care plan or a 715. The reason being is because most of that information is automatically populated or it's using a wizard system, which I'll show further in my presentation, So you can actually talk to the patient. I've gone to a few practices in my time where I've spoken about how do you find INCA, and they go, it's great. And the reason they say it's great is because when a nurse does a care plan or a doctor does a care plan, they might find something else with the patient while talking them through the care plan, rather than sitting there writing out the care plan and then at the last minute having a 5-minute conversation. With this, it gives you that time to sit there and actually find other reasons or other information about the patient, which could be highly valuable to the care plan or the 715 assessment while you're doing it. It improves your appointment utilization. So with appointments, what it does is gives you all the follow-up dates. It also integrates with your recalls and reminders. So it will tell you when the next appointment would be for the review of the care plan. It will give you appointment set dates for when the referrals are going out. All the other information is kind of all automated in there. So it really does help with that. It improves the clinical data. So what we also do is when you load a patient into our INCA platform, it will tell you any QPIP or EPIP information that is missing on the patient record. So then you can go back into your PMS and fix that. So it's cleaning your data up along the way. It strengthens the relationship with your local allied health. So a lot of you might not have internal allied health. You might use external allied health vendors, which is mainstream at the moment. It connects them into the system. So when you create a care plan, it automatically sends them an invite to get onto our INCA platform, and it's free of charge. You guys are getting a 12-month license, but all allied health don't pay for the platform. They get access to it under your license. So they're then connected to that care plan and see all that information that you've gathered about them and the care plan, their referral and all the information about the patient. So when the patient first turns up for their appointment or turns up after they've called you or discussed that appointment, you've got everything there on hand. The other thing it does is it lets you, as an allied health person, put in notes. So as a GP, you'll be able to see what the allied health person has done with that patient. So they might have just done a standard appointment, written the notes, everything is good, or they might have given some changes to the patient's outcomes during their appointment, and they can put those notes in there for extra information. It also helps with reducing patient risk of hospital admission. So we have a risk stratification tool, which is another side of the software, which can categorize all your patients in your database from high risk hospitalization to low risk. And you can constantly use that calculation-based assessment within the software to go through your patient database and pick out those patients and manage them accordingly for their chronic diseases. Okay. How does it all work in the platform? Firstly, what it does is, you can see my screen here, I've got best practice there on the screen. It connects directly to the database inside BP, MD, ZMed, MedTech, Communicare. So it connects with majority of the PMS systems out there. And what it can do is it can pick up the recognized chronic conditions of a patient and connect them to say that that patient is available to have a GPMP or TCA. So as you can see, it's created a pop-up on Clara, my patient, to say that she's got diabetes, depression, chronic heart disease, angina, psychosis, and back pain. So she's got a few issues there. But what it will then do is it will let you create a patient record in INCA. When it does that, it creates the patient record in INCA on your web platform. So it opens it up in a web browser. And this is the screen or GUI interface that you see. So what it's done is it's taken all that patient demographic information. It's done the age group, their BMI, their hospitalization risk, weight, height, and it's also given a lot more other demographic data, but this is just showing you kind of like an overview. The next box down, you'll see that it's also stated that that patient is available to do a health assessment. So it's automatically figured out that that patient fits the criteria for a 715 assessment. So then you can click on that button and it will take you directly to the assessment. Okay. As I said before, we have a full library database of assessments. So this would come up directly if you didn't click that assessment button that we showed before. It will show all the other assessments that are available to you for this patient via their demographic and their information that's on record. Once you click that, it will open up the assessment. And like I said before, the assessment is dynamic. So it pulls a lot of the clinical information into it for you. And you can go through the assessment with the patient, filling it out at the time of appointment. And while you're doing it, it's automatically saving. So if you forget or you lose track, it just remembers where you were at last time. Once you fill it in, it will then go through the steps and let you go into creating a care plan. The care plan side of it, like I said, it's a wizard system. So it goes through the system, picking out those chronic diseases that you want to do for this care plan. So in these categories like chronic disease, kidney disease, diabetes, back pain, all those kind of things that can be part of a care plan. And it will automatically pull the daily actions and activities that associate to those chronic diseases. So as you can see on my screen here, I've got the patient's vision for the next 12 months, but then it's also created the patient actions and timelines. These timelines and activities are interchangeable. So what I mean by interchangeable is we've got a full library list of multiple options for you to select. If those selections don't meet the criteria that you're creating this care plan for, you can write your own or manually edit the actions and activities that you see here. So like the second one here that says walk around the neighborhood for 30 minutes. This patient could have an ankle injury or mildly obese. They can't walk for 30 minutes just because of that injury. You can change that down to 10 minutes. Things like that. Very easy to change, very easy to adapt. Same thing with the ongoing activities. So you can change those, select them from a drop-down box or into your own. Once you've done this, you don't have to do that again. You can also save it as a template. So if you do a lot of the same care plan, a lot of patients in the same kind of chronic disease vertical, you can set them up as templates and continue using them, making small adjustments for that patient to be more exact. As part of the care plan, it also pulls the clinical outcomes and procedures. So as you can see on my screen here, it's got all the clinical observations that have been taken with the patient. Now, these could have been taken and written into INCA, or they could have been pulled from the PMS. So in this regard, they've been pulled from the PMS system. So I've got my readings for my weight, my height, and my BMI. I've also got the last blood pressure reading. So as you can see, these are in the red. The reason they're in red is because they're outside of their target weight or they're in a bad state for their current measurements. We can change the frequency and we can change the targets for each one, and you can enter new values. The system is constantly pulling data from the PMS system. So if there is an updated figure on any of the clinical outcomes or observations that are taken, they will be automatically updated. So you don't need to type them in or push a button to update it. It automatically refreshes for you. So it constantly keeps that data information up to date. So then everyone that's accessing the health record or the care plan can see those latest facts and figures for the patient. So you might have just got the results in for a blood test and they're about to go see their allied health or their specialist. Those figures will be put into the system automatically. On the right-hand side here, you can see the care team. So like I was talking about, it automatically shares the care of this patient and all the documents, including the referrals and the care plan, with the care team automatically, and gives them access to it. So how it does this, firstly, we integrate with your address book within your PMS. So you've got a built-in address book with all your allied health and specialists that you use, and you send the referrals through to them. What it does is it takes that address book and populates it into our platform. So then you can digitally share those records with them and gives them direct access and a password and login to the INCA platform to then access the information. There's nothing for them to do. The sign up is all automatic, so it's very easy. They can just click the link, open it up, and accept that they are going to be part of that team care arrangement or that care plan. What it also can do is assign tasks and treatments to other members of the care team. So as you can see here, as part of the care team, it's arranged my foot exam with my podiatrist. It's set the frequencies for me. Same thing with my diet and lifestyle changes. So if I have a nutritionist, I can automatically organize that to be part of the team care arrangement. I can do nutrition education with my dietitian, and I can also set diabetes educators if I'm on a diabetic patient. You can also see there it's part of a cardiologist review, so I've sent it automatically to the cardiologist. And they, like I said before, can also add notes. So the podiatrist has done the foot exam and found issues with the back heel on the right foot. They could write that note in there. That note is then visible to the GP to know that they found an issue with the person's right foot, back, ankle. It gives them the ability to update each other without having to do phone calls, write notes, give them to the patient, and then that information getting lost in the ether between the two parties. So it's a really good way of a collaboration of with all the care team together in one place at one time. A good example of this is the Royal Flying Doctors up in Western New South Wales use this platform to look after patients remotely, and especially around when COVID was around. They were doing COVID assessments and they were sharing that information while they were out in the field on a plane with the GP back at main base. and seeing that information flowing back and forward without the need of having to wait, land, go back in and say, hey, I've seen a patient, I've done this, et cetera, et cetera. So it's a really good system for that, where it kind of brings everyone together in a collaborative platform and shares that information at a moment's notice. So when it does the care plan, what it does is, like I'm talking about here, it does an electronic sharing. So you can see here it's automatically released and approved the care plan to send out to all those people in the care team arrangement. And as you can see here, it's telling me that each person has been sent an either email or a fax, or maybe even a manual contact may be required because they don't have a fax machine or they don't use email. But it gives everyone access to the platform via a multitude of different ways of connecting them all together to make them a collaborative effort around 715s and the care team and TCA arrangements. Like I was talking about before, the patient dashboard. So you guys will put all your patients on the platform that you're doing your care plans and your 715s in. It will list them all. So if you have a nurse or an admin person that needs to follow up where the GP plans are or where the TCAs are, it will give you a view of them all sitting there, where they are at their story on the care plan or the TCA. So you can click on each patient, see where the review is waiting approval, who hasn't signed on. So if Allied Health haven't ticked and agreed, the TCA review might be waiting or pending an agreement. You can click on it, push it through, check with your Allied Health, et cetera, et cetera. It kind of gives you a really good overview of what's going on in your practice with all your patients, rather than having to go through patient by patient or even printing out a piece of paper and crossing the name out once you've contacted them or spoken to the Allied Health person involved in part of that care team arrangement. So that's kind of the demo for tonight. Each one of you can have a personalized demo. So what we've done is organized our availability to all the practices there with you guys to go through the platform, show you how it works in an individual practice level, and then have a trial or have a look at a system and then get it installed and start using it. You've got a 12-month license, so straight away you can start using it and getting those patients up and running on 715 and a care plan and TCA arrangement. Does anyone have any questions for me or any questions about the INCA platform?
Hey Ben, it's Emma from City Street Medical. Just a quick question about the results side of things. So obviously it takes it out of the HL7 format and drags it in.
Yeah, correct. So the results come into the BP platform, MD platform, whichever platform you have. It then pulls them in and brings the results into the platform in a legible format. So you like your blood pressure, BMI, your lipids, all that kind of information directly comes into the platform and gives you the readings, the direct readings from the pathology and radiology results.
And where does all the data sit for INCA?
It sits in two data warehouses in both Sydney and Melbourne, so it's encrypted at rest level. So none of that information is shared. You're on your own singular platform, so it's not a shared platform. So clinic down the road might be on INCA and you might be. None of that information is shared. We plug into the My Health record, so it meets all Australian digital health standards. So we've met all the security standards, and like I said, it's encrypted. So any information can be seen without using the actual INCA platform, and the transfer is also secure as well between the PMS and the INCA platform.
And does it actually work with Cat4, or is it just a standalone thing?
Standalone thing. It doesn't work directly with Cat4, but the connector connects directly to the database through its own platform, not through Cat4.